The College of Physicians and Surgeons is the state regulator of medical practice in the province of Ontario. In December 2014, the college began a public consultation about a proposed policy called Professional Obligations and Human Rights. The proposal had been drafted following a public consultation conducted by the college earlier in 2014. The college asked the public to review and comment upon the draft policy by the 20th of February 2015. Through Professional Obligations and Human Rights, the college proposed to institute a policy of effective referral. That is, physicians unwilling to provide a procedure for reasons of conscience would be forced to help arrange for it to be provided by someone else. This was highly controversial. 3 years earlier, the president of the Quebec College of Physicians had told Quebec legislators why many would find compulsory referral unacceptable. If you have a conscientious objection and it is you who must undertake to find someone who will do it, he said, your conscientious objection is nullified. It's as if you did it anyway. The earlier college consultation had revealed strong support for physician freedom of conscience, but also that the idea of imposing effective referral was highly contentious. The public consultation opened on 10 December 2014 and closed on the 20th of February 2015. By the end of the consultation, the college had received over 9,000 submissions. 737 responses had been received by the 28th of January and 3,105 by the 11th of February. The college received an average of about 15 responses per day up until the 28th of January. From the 29th of January to the 11th of February, this rose to 113 per day, 5 per hour, or 1 about every 13 minutes. During the last 9 days of the consultation, this increased to about 684 responses daily, almost 30 every hour, or 1 every 2 minutes. These numbers reflect the volume of incoming responses 24 hours per day, 7 days a week, while the consultation was open. However, college staff did not work 24/7. There were 61 working days between the beginning of the consultation and a meeting of the College Council in the first week of March. We'll now consider how much time was available to review the responses before the meeting. As we've seen, the volume of incoming responses did not begin to increase significantly until near the end of January. Thereafter, the volume increased dramatically until the consultation ended. The College Council was to meet on the 6th of March, so a report of some kind presumably had to be completed by the day before. How much time did college staff have to review the submissions? There were 61 working days between the opening of the consultation and the college meeting. We assume one staffer spent 8 hours each working day reviewing responses. The staffer would have had 23 minutes to review each of roughly the first 800 responses. Almost 2,400 responses poured in during the next 2 weeks. The staffer could have spent 2 minutes on each. The college was flooded by 6,100 responses in the last 9 days of the consultation, 1 every 2 minutes. With the additional workdays from the end of the consultation to the eve of the council meeting, the staffer could take 1 minute to review each. Submissions from the Ontario Medical Association, the American Medical Association, the Evangelical Fellowship of Canada, the Christian and Medical Dental Society, the Protection of Conscience Project, and the Justice Centre for Constitutional Freedoms were among those opposing the requirement for effective referral. However, these were among the roughly 6,100 responses in the last days of the consultation that were each eligible for about 1 minute of attention by a college reviewer, or 10 minutes if the college employed 10 reviewers. However, it does not appear that even 10 minutes attention would have made any difference. The wording of the policy, including the requirement for effective referral, had been finalized a month before the consultation ended and approved by the college executive before these submissions were received. In fact, the requirement for effective referral was finalized and approved by the college executive before they received over 90% of the invited submissions. The college had probably received only about 600 submissions when the working group finalized the policy a full month before the end of the consultation. The college had received 737 responses when the finalized policy was forwarded to the executive. It was approved by the executive 3 weeks before the end of the consultation. Over 6,000 responses had yet to arrive when a briefing note to council members recommended approval of professional obligations and human rights. This strongly suggests that the public consultation was a merely theatrical exercise, largely irrelevant to an outcome that had already been decided upon by college officials. College council followed their lead and approved the policy almost without question. The college has launched another public consultation to update the policy. It's invited the public to respond to the preliminary consultation by the 12th of April 2021. More smoke and mirrors to provide cover for decisions that have already been made? That remains to be seen.